60-year-old female presenting with chest pain. She's been on isosorbide dinitride, hydralazine, and aspirin for the past 3 months. The exam reveals a fine, mildly erythematous rash on her cheeks and nose. Her labs show a positive anti-nuclear antibody titer of 1 to 1200, a positive anti-histone antibody, and a negative anti-double-stranded DNA antibody. She also has a right pleural effusion. Given this presentation, which of the following management approaches is most appropriate for this patient? A. Discontinue the hydralazine and continue observation. B. Initiate treatment with prednisone. C. Perform a VQ study. And D. Initiate treatment with rituximab. The answer is going to be answer choice A, discontinue the hydralazine and observe. Drug-induced lupus is a syndrome associated with certain medications, and hydralazine is a classic culprit. The key here is that it is distinct from SLE. Our patient has a positive ANA and antihistone antibodies, but importantly, a negative anti-double-stranded DNA antibody, which points away from SLE and towards drug-induced lupus. Discontinuing the offending drug is usually going to lead to symptom resolution within weeks to months. The primary treatment and often curative is simply stopping the drug, so the other answer choices are going to be incorrect. Drug-induced lupus is a condition that looks a lot like lupus, but it is actually triggered by certain medications. The drugs most commonly linked to drug-induced lupus is hydralazine, isoniazid, procainamide, penicillamine, minocycline, and the TNF inhibitors. Clinically, patients might develop fever, inflammation around the lungs or heart, that's going to be psoriasis, joint pain or arthritis, and sometimes a rash. Now, the exact cause is not fully understood, and there aren't any formal diagnostic criteria for this, but what we typically see is a positive ANA test. But unlike classic lupus, the anti-double-stranded DNA test is usually negative, except in cases related to TNF inhibitors. Antihistone antibodies are common in drug-induced lupus, but it is worth noting they can also show up in patients with SLE. Here's an easy way to remember it. Think, aha, I got you, as if the antibody just unmasked the villain. AHA, AHA, stands for antihistone antibody, which is the classic clue that reveals the drug culprit behind lupus-like symptoms like unmasking hydralazine in a Scooby-Doo episode. So in summary, antihistone antibodies are typical and expected in drug-induced lupus, while anti-double-stranded DNA and anti-Smith antibodies are more characteristic of true SLE. And in terms of management, the key step is to stop the offending drug. Once that is done, symptoms usually resolve within a few weeks to a few months.